Hi, welcome. This is Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. We're out of the Waisman Center. We cover 14 counties in southern and southwest Wisconsin. We are here to help parents to be supported as they deal with the system of care for their children with special healthcare needs. And we help those professionals who help our parents to make the system a little bit better. I want to remind you today that we are being recorded. And so anything that you say is going to be forever and ever online. So please be careful what you say, and especially we ask that you do not use any personal identifiable health information or personal information. Also want to remind you that we are not dispensing medical advice. We are not dispensing legal advice or educational advice. We are simply having a conversation. Our conversation today is about anxiety and ideas to help our kids be calmer and more focused. So excited to have Connie Persike with us today. I have heard Connie speak many times, and when someone said, you know, you should do something on anxiety, she was the first person that I thought of. Not because she produces anxiety in me, no, but because I've heard her talk on anxiety, and it's all good stuff. So Connie is a speech language pathologist and behavioral consultant from CP Consulting. Today, we want to talk about ideas for helping our kids and possibly even ourselves deal with our anxiety while we're staying safer at home. And in the current environment, possibly even talking about what is it like to be safer at home as things are reopening, and what's reopening, what's not reopening, what does reopening mean, and the whole anxiety of the unknown. So Connie, thank you so much for being here today.
Thanks for having me.
Absolutely. So one thing that I always wanted to ask you is that I know that you're a speech language pathologist, but I've always known you as this super cool consultant who's been going in and helping schools and school systems figure out how to help their kids who are challenged by anxiety succeed within the classrooms. How did a speech language pathologist get involved in anxiety?
Well, I'll try to make that short, but I have to go back 20 years because my very first job was in a classroom that CYSHCN ran. It was called the First Step Autism Program. I had the pleasure of being supervised by Susan Stokes, who is like phenomenal when it comes to anything related to autism. And so it was a very non-traditional role. I was in the classroom all the time. I was team teaching. I wasn't doing like the typical pull-out speech and language. I was, working on expressive language and getting them to really learn how to communicate and be independent and help meet their sensory needs. And basically, I team taught with an occupational therapist, a teacher, and myself for 5 years. So I learned just a ton about a lot more than just speech and language. And so then I went on and did some more typical roles as a speech path, but always loved supporting behaviors. I just kind of fell in love with behaviors in general at that first job. And then when I started this business about 7 years ago, I think we're going on our 8th year, but I realized really fast anxiety was super prevalent, and especially in the population of students with autism. And I was getting more and more calls about kids who were refusing to come to school altogether, or when they came to school, they were leaving class because they were so impacted by their anxiety. If their parents could even get them to school, they were, attempting class and then leaving class. And so I just kind of became like really interested in the topic. I started reading and learning as much as I could. I'm not going to lie, I'm probably more of a person with more worries than the average person, so I can relate to that. I have specifically like some medical anxiety that kind of goes hand in hand into some experiences I've had. And then my daughter actually was born with a very highly reactive temperament, which is a temperament style, but it can make you a little bit more of a worrier, a little bit struggle more in new situations. And she struggled big time with separation anxiety. And so as a parent, I've learned a lot about anxiety also. She also has a chronic medical condition, which activates that same fight-flight response that anxiety activates. And so I kind of feel like they go hand in hand when it comes to chronic pain. And so I have just learned a lot on a personal note and to support my students that I support. So it's kind of like long story short, how I got into it.
I see, and again, I've known you for years, but I had no idea of the backstory. And I could so totally relate to the fact that, hey, this is something that I really enjoy and it's my passion, but guess what? I'm also personally
Mm,
connected and I'm personally invested
yeah,
in the work that I do with my 22-year-old son with autism and anxiety.
right, right,
Um, so I've had to live and learn
right,
all at the same time. And now you get to live, learn, and teach,
right.
which is really, really cool. So for the past, I don't know, we're at 8 to 10 weeks. We've been under this safer at home order. Kids have been out of school. Um, some people would say chaos has reigned. Other people are just like, this is one of the best things that's happened since sliced bread. It's just been amazing. Have you had the chance to talk to families in the past couple of months? How are they doing? What are you talking to about families?
Right. So most of my work, I'll be honest, is contracted through school districts, but I have been a part of IEP meetings virtually with the districts. And I do have a handful of parents that contract with me and like get my support during the school year, which they surprisingly, I have to be honest, they haven't really needed a ton of support from me right now because their children are doing really, really well at home. Most of the students that I was consulting with had autism and some sensory issues and anxiety that made it really hard for them to be in school. And so the virtual piece has been really refreshing for them. The students are doing well and thriving according to their parents. And even the IEP I just had recently with a district that I support, that student actually joined his IEP. He's a middle school student and he is really loving virtual school. And he asked everybody if they could pursue partial virtual school in the fall, even if we're back in, because it's helping him so much. So
That is interesting. Do you have? I mean, what exactly is it that's? I mean, from a dad point of view, I
yeah,
can have my ideas about why my kid might be less anxious at home, but what sort of things? What's tying into this lesser anxiety? And then, how do you think that might be able to transfer to schools in the fall?
yeah. And I don't want to make like I don't want to make an assumption at all that all kids are doing well because I don't think that's the case. But the handful of kids that I was supporting, they have found it very helpful. I don't know. I was asking the parents that myself. I was saying, do you think some of this is sleep? Like they're getting more sleep, they can sleep in, because I know for myself, if I'm more rested, my worries and my anxiety is more under control. And a lot of those students struggled with sleep to begin with. And so they think it's a little bit of that, yes, but also a lot of the kids that I'm helping with have a lot of chronic, sensory differences that make school really hard. The one student in particular that I'm talking about, he like hates sounds. He hates when people whistle. He like really struggles with knowing what he can control and what he can't. And so he wants to make everybody else be quiet instead of like put headphones on or shut the door or go to a different room. And he has just found it from a sensory perspective a lot less fatiguing. He doesn't have to deal with those all the sensory input that happens in a school. I think that's a huge part of it. Chronic with anxiety can come chronic irritability, and you can become more annoyed by things that people are doing, little things, and they don't have that very often at home. I mean, anything that's routine, any sensory information that's routine and like happens to you on a regular basis is much easier for your body to process. So when you're at home, all that sensory information is like regular input that you're used to. And so versus being in a school with all sorts of different variables that make a lot of unexpected things happen.
Yeah, so you're sort of used to. I would think that maybe part of it is you're very used to the people in the environment at home have
Mm-hmm,
probably gotten some sense of flow and consistency.
mm-hmm,
Even though school is at home and that's different, it's still this overall environment.
mm-hmm.
Whereas school, there's so many different moving parts
Right,
that it's hard to get um, this is what it is there's always something that's going to be surprising,
right.
which in and of itself is anxiety producing.
Mm-hmm, mm-hmm. Right. I mean, just being around other people, you can't, especially in a school environment when it's a lot of different people, we can't make everybody predictable all the time.
What?
Yeah.
What? People are unpredictable?
Yeah.
Well, I'm glad I'm not the only one who experiences people as unpredictable. So it's nice to know I'm not alone with that.
Right, right, right.
So have you learned anything new from dealing with anxiety during COVID-19 than, the normal stuff that you've been studying for 7, 8 years?
I think what's been really eye-opening is, and I always used to say this when I was in the classroom and I had consultants come in, like, sometimes they would give me these textbook answers and I'd be like, but that doesn't apply in this situation. Like, I know what the textbooks say. And I've always really strived not to become that way. Like, I really want to listen to the people that I'm supporting. But I think it's been really reaffirming in that sense because, like, I mean, you've heard me speak about anxiety. One of the best things we can do for somebody who's anxious is increase predictability and, make schedules and routines predictable. But I've learned just for some kids at home, that's not working. They don't want their home life to be structured and scheduled and so I think it's reaffirmed to me that one size definitely does not fit all. Like the supports that we provide our students have to be so individualized on what they need. And a big part of the routine at home, like for us, we're not scheduled people when we're at home. When we're going to school and when we're working, we live a pretty like routine-based situation. But in the summer, when we're not working and we're all home, because my husband's a teacher too, we don't have a ton of structure in place. And so for me, I can't structure up my daughter's day. That would not, I've kind of like fought the virtual school piece and that for her because I can't like at 1:00 say, okay, you're going to do a Google Meet now. You're at home. And I'm not willing to change my daughter's home life experience for that right now. And so I think it's reaffirmed to me that one size does not fit all. And for some kids, all the textbook stuff that we say helps anxiety. We might need to be thinking outside the box in this time. This is so unique. I mean, none of us have experienced anything like this before. So
given, yeah, just because, I can put you on the spot because you're my friend and stuff. So given that, yeah, you're welcome. Given that there is this individualized element to it, given that maybe the textbook anxiety, give them a visual schedule, make sure they know what's coming up next, make sure you warn them when there's going to be a change, a change in schedule, let them know beforehand and process it, give people time to process change. With that individual stuff, what else is there that families can do to help their little anxious kiddo that they're now around 24/7?
Right. So I think definitely still use those tools and learn about them. And there's all sorts of free resources right now. I did want to mention that GoZen has a free Facebook page to increase happiness, the science of happiness for children and families. And it's a free.
And you will email me those afterwards, and then I will email them to the people and I'll make them available to the people that watch this.
That's great because there's all sorts of research, especially in the world of positive psychology, that if we can just focus on being happier and focus on well-being will decrease anxiety instead of focusing on the anxiety piece of it. But still, I think parents should learn those strategies and like take advantage of the resources that are out there, but know your child and know what's going to work for your child and what isn't. And like, trust your gut, I guess. Trust your gut on that. Because as a parent, we all have gut feelings on what's going to work. And don't second guess yourself and say, well, the experts are telling me I need to have a schedule while your child's melting down. It might not work. It might not work for your child. And just, your child best. And so just trust your gut on that and take care of yourself. I think that's been so important even for me. At the beginning, like when we were, things were changing by the hour and you're constantly checking your Facebook feed and checking the news to see what changes were happening. I just know when I was like that, that was the highest part of the anxiety, like the highest level my anxiety got was during that first couple weeks when things were changing all the time. And we were constantly looking at the news and watching the news and I've had to really limit how often I do that just for my own well-being and take care of myself because all of our emotions are contagious. And if I'm anxious, my daughter is going to be more anxious. And so I've had to really focus on limiting how much news I take in, how much negative news I take in, and even like getting into the flow. And that can be totally different for, it's called focus. Dan Siegel refers to it as focus time, or the positive psychology gurus call it like flow, getting into your flow. But just having time where you're doing something where you only have that end goal as your focus. And so that could be gardening for some people. It could be landscaping. It could be, I guess the gardening centers are really, really busy right now. They said they've never seen anything like this. So it must be like healing for people to plant. But cleaning, sometimes cleaning can get me into that flow, or just doing work. I found that the more I was in times where I'm just really focused and my mind isn't going into all the thoughts about what's going to happen and the uncertainty of all of this, the better off my emotional well-being is. So I think that's something parents can definitely do, that across the board, just take care of yourself, because if we take care of ourselves, our students, our kids, or our kids are going to do better, and they're going to like rub off, their emotions going to rub off on how you're feeling. So that's been really something.
I love that. I love that emotions are contagious. Is sometimes we forget that, is that we can spread either good emotions or bad emotions or indifference, but that it can be contagious. So far I've learned emotions can be contagious. Take the professional advice and apply it personally to your kid, is that not everything is going to fit like a nicely fitted suit, that it's more like something that's draped over and you have to mold it to your child and to their benefits, to what their strengths are and what their needs are. I do want to take advantage of your professionalism and go ahead and blow it out to that 20,000 foot overview. So then if we have those kiddos that are dealing with anxiety, what are some of the main things that you try to teach teachers to implement into the classrooms to help, again, that 80% that are going to react to this, and get to a point where then they can deal with the changes and deal with the unknowns, but sort of setting a better baseline to help them? What are some of those big ideas?
So big ideas that I would do in an everyday world or right now?
Let's go everyday world, in the sense of hopefulness that we'll someday have an everyday world.
Well, and that's what I do a lot too, is I think we can constantly be modeling, as parents, we can be modeling self-talk, and even as teachers, the way we talk to kids they pick up on that. Like anything you learn about social emotional learning, the biggest predictor for a student or for your child is how you act yourself, the people around them, how they're modeling those skills. And so keep in mind, I'm always telling people to model expressing your emotions appropriately and putting some space between your feelings, like not saying I'm anxious, or instead saying I feel anxious, or I notice that I'm feeling anxious. So you're not associating yourself with that feeling. It's just like a cloud that's going to pass by. I mean, right now you feel anxious, but you're not always anxious. It seems like a little thing, but it can do wonders. So modeling that as an adult, naming my feelings to tame them. If we can name our feelings, it actually calms your brain down a little bit. So having that awareness of what you're feeling and saying it out loud. If your child can't do that yet, or your student can't do that yet, you can model that for them, and it has the same neurological effect on them. Providing predictability is something that I feel very strongly about. Even right now in this uncertainty, we can provide a little bit of predictability. Like we can say, but we have to also introduce that concept of change. Like, hey, right now we think this is going to end May 26th. And showing that visually to some kids would be very, very helpful. And then oops, that might change. And so that's going to be if your child doesn't understand the concept of change, if anybody doesn't understand the concept of change when it comes to anxiety, we need to start working on that and introducing that so that
How can you, you don't want to sit there and surprise your anxious child every minute. All of a sudden, hey, we're having dinner this morning for breakfast, and then guess what? You're going to go into the basement when normally you go to school. Ha ha ha. That doesn't seem to me like a really great way to introduce change to kids with anxiety. So what are some ways that we can introduce change, introduce the concept of this is what we expect, but it may not happen?
Well, you always want to start out with positive change. You don't want to introduce the concept around something horrible and negative. And so like one example could be, today we're going to have, a change. We're going to have dessert first before dinner. So it's something positive and exciting. Or, this wasn't on the schedule, but we're going to call grandma today, or we're going to FaceTime grandma today. That's a change. That's what's in the schedule. Or if you're at school, we were going to have, some really healthy snack, and well, we're going to change that to an unhealthy snack. Or we're going to do a fun game instead of math. So I would start introducing that. And for our kids who rely heavily on visuals, I would just make up a visual that, whatever. We used to use a lightning bolt because they're unexpected, but you could make whatever visual you want, but just make it be the same, make it be consistent. And you could pair that change with a visual picture of it. I don't really think there's a concrete way to visually display change. So it's going to most likely be abstract, but if you use it consistently, the students will, your child or the student will learn what it means. And so I would start with something fun, positive, and introduce it, and slowly move into, not positive changes. So like today we were going to go to the doctor. Oh, that changed. We're not doing that anymore. We've had a lot of those.
Right, exactly. We have all these, all of us had these calendars that had all these appointments on them.
Exactly.
That now we don't have them, and we don't know when we're going to get them back.
Mm-hmm. Yeah. And if your child is doing better right now, like my daughter hasn't had a single migraine since they were at home, not one. And she was having them very, very consistently at school. And so I'm just constantly trying to think, what can we be doing more next when school goes back in session to decrease some of the triggers that are causing the migraines. Like I'm just trying to keep in mind what could be the difference, what could be alleviating some of that, the triggers to her migraines. And like then have conversations with your school when you go back and be like, this really worked at Save Her at Home. I think we need to be trying some of this. And if you have a child that's doing better. So
I love that. I love that suggestion, because it goes back to if people were joining us last week, we were talking virtual special education. And one of the biggest takeaways that we learned from the people at the Wisconsin Virtual Academy is that they have it seems they have an increased communication between parents and the teachers than what some of our families experience in brick and mortar schools.
mm-hmm.
There's just this need to continually talk about, this worked at home, this didn't work at home. This worked during the lesson, this didn't work at the lesson. Hey, this worked really well, so can we try it over here?
Right.
And that whole communication that you're talking about, I love, is that parents have this opportunity, not a great, woo, yay, yay, celebrate. No,
Mm-hmm.
not at all. It's harder than anything. But there is this opportunity to learn a little bit more about their child and how their child learns. And being able to then explain their child and their learning to the teacher, and having the educator listen with the knowledge that this parent has this experience and that they've lived through this too. And this is what's going to work. Because I've not met many educators who don't want their students to learn.
Right.
They want their students to learn optimally. They want their students to succeed. They are on that student side. And so having that conversation between the parent and the teachers, hopefully when schools are able to get back into session, about, hey, here's some tricks that worked at home. Here's some tips that worked at home. How can we do this at school?
Right. Exactly. Parents know their children best. And schools really need to listen to that input. And you're exactly right. I mean, now we've got to experience, time teaching our children, can come to the table just a little bit more prepared with some more ideas and anything that we've learned. So, yeah.
Cool. Well, we're going to close out this portion of the day, but do you have any final thoughts on what you've learned, what has worked for others, or how you, obviously personally, what you have learned about anxiety and helping our kiddos at this point?
Two things. I wanted to mention one thing in particular for right now, because this is, we sort of have been somewhat of a spoiled generation. We haven't gone through some of the hardships that other generations have gone through. And so just keeping in mind that this is temporary and modeling that type of language for your child, I think is really important. Instead of like, I'm never going to see my cousins again. Changing that and reframing that sentence for your child into like, temporary language, like, oh, you're not going to see them today or next or this week, but we will see them again as soon as things become safe again. Or that's not safe right now, instead of, you know, that's just not safe. Like making sure that we use language that very much increases hope and optimism, like you said, instead of pervasiveness, because this isn't going to be pervasive. And like doing a lot, I mean, there's so many great storybooks out there for it doesn't matter what age your child is, just like narrative nonfictions about people who've overcome really challenging times. And that can be really great to do right now, is to like share stories of people who have overcome, watch movies of people who have overcome, so that we can remember that this is, you know, we can overcome this, and this is temporary for us. And kind of trying to take it one day at a time, because if I start thinking many days out or weeks out or what fall will look like, then that's when our worries start spiraling. So I'm trying to think of like my very small steps in this process.
Right. Is, you know, some people think that hope is just this huge, overwhelming thing that just sort of happens. And for some people that may be true.
Yeah.
But for me, sometimes I have to be walked into hope. Is I have to be reminded of why I should be hopeful, and be reminded that even though it feels horrible right now, it's not going to feel horrible forever.
Right.
That there is an end to this. And so I think hope is a great way to help deal with anxiety. Let's get through this pressure moment, knowing that there's more than this pressure moment, that this anxiety that I'm feeling, I can work through this. It's something we can work through. It's not something that we're going to be forever and ever and ever.
Right, exactly. And our language is so powerful. Just by tweaking our children's language, or tweaking a student's language by rephrasing it that's gonna be a great model for them. And oftentimes what we say is going to become their own, you know, inner voice. And so we want their inner voice to include temporary language and not permanence in this situation. So yeah. The only other thing is to focus on what we can control. I mean, that, I think, like, you know, I can control the germs getting into my house. I can control cleaning my groceries before I bring them in, like trying to really focus. And a lot of our students who experience anxiety struggle with that. They struggle with knowing what they can control and what they can't control. And so I will send you that that Facebook link, because they have a free printable that you can print out on what I'm in control of and what I'm not in control of. And just keeping that in mind, because the more we can remember what we have control of, the less our anxiety is going to be. So that's why everybody was cleaning so much at the beginning.
Yeah, exactly. I totally get that. I can control that. I am not a normal outside person, but I have weeded more this year. I don't know. There's just something about looking out of the front window and not seeing the weeds in the garden that make me feel just a little tiny bit better. If the garden looks nice, I just feel a little bit better about the day. Which I don't get, but it's there. So I'm gonna keep doing it.
Exactly.
Because it helps. I'm going to take a moment, as I know that we have a couple of people that have been listening in, and I just want to give them the opportunity to unmute and feel free to ask any questions that you might have. So if you are listening live, please feel free to unmute your phone, and any questions for Connie would be very welcome. In the meantime, Connie and I will just look awkwardly at the screen.
This is the problem with live.
I know, right?
It's like,
yeah. I am not seeing any hands raising, and I'm not seeing any unmuting. So I am just going to go on ahead and thank you so much
Yeah.
for being here today, Connie. And I would also like to invite everybody back to our next conversations on Showing Up for Kids. We will be talking again next Wednesday, May 27th at 1 o'clock. Our topic is going to be rural Wisconsin, the good, the bad, and the ugly. We're going to be, I love that title. I came up with it, well, we came up with it as I was talking to Rose Cutting. Rose will join us. She's a rural Wisconsin community member, founder of Aiming for Acceptance in the Learning Center. And we just want to try to get her perspective to help us learn a little bit more about what's happening with families in rural Wisconsin. So I hope you're able to come back and join us next week. Connie, thank you so very much. Take care, have hope, and we'll talk to you later.
You too. Bye-bye.
Bye-bye.